Hello and welcome again. Dr. Anthony Gonzalez here in Miami Community Health. As always, we have another important topic for you today. We are going to talk about the biggest organ in the body, the largest organ in the human body. Do you guys know what the largest organ in the human body is? Well, I've brought a specialist today to talk about it. And I brought my friend, my colleague, Dr. Arthur Colsky, a dermatologist, to talk to us about the skin, the largest organ of the body. Welcome, Arthur.
Thanks, Tony. It's a privilege to be here. Thanks for having me.
All righty. Pleasure. So why don't we start off just, Arthur, tell the audience a little bit about yourself.
So I was born in Miami and I grew up here. And then I went off to Tennessee to Vanderbilt University for my college studies. I came back to Miami and I did my medical training at the University of Miami and subsequently my residency training in dermatology. And then I began a practice here in the community, which I've been doing for approximately 25 years.
Yep. Yeah, Arthur and I are contemporaries. We spent our educational life together as well. So we know each other for a long time. So a dermatologist, what does a dermatologist do? Of course, a dermatologist has to do with the skin. So you look at the skin all day. That's what you do?
That's what we do. Dermatologists are medical specialists that take care of the skin, hair, and nails. So as you mentioned, the skin is the largest organ in the body. So you can imagine all of the different diverse things that can happen in the largest organ. The skin is not just a covering. A lot of people think it's just a covering of the body, but it's actually a very alive organ, and it has a lot of its own unique functions, and it has its own immune system. It has a lot of other systems, and it interacts with our internal organs in a variety of ways to keep us healthy. So we have in a regular dermatology practice, we might see things as diverse as skin cancer, eczema, psoriasis, acne, warts, nail problems, hair loss. So and even cosmetic treatment. That's a very big aspect of dermatology here in South Florida. So it's a variety of things that we typically do each day.
Yeah, and so you're mentioning the skin. The skin really is not only a protective, it protects you as well, but it also has to do with temperature control and water balance and perspiration and everything else. So it's a very complex organ in that regard.
Absolutely. People don't understand the significance of the skin, and it has so many facets that interact with keeping us healthy. And it interacts with the neurological system. It interacts with the immune system. It interacts even with the psychiatric system. So there are a variety of ramifications that it's important to keep the skin healthy in order to keep ourselves healthy.
All right. So you mentioned all the different conditions that a dermatologist in South Florida can deal with. And one of the ones you mentioned was skin cancer. So let's start off with skin cancer. And that's something people are always concerned about. As a surgeon, I see somebody in the office for a gallbladder hernia and they say, "Hey, doc, look at this. Is this a skin cancer?" Everybody's really worried about skin cancer. So explain to us, what is a skin cancer?
So skin cancer is extremely important, especially here in South Florida. First, skin cancer in general is the most common type of cancer in the world. So there's no other type of cancer for any other organ that is more prevalent than skin cancer. And skin cancer, there are a variety of types. There are many different types of skin cancer, but we typically have 3 different kinds that we talk about because we see those more commonly in our practices. And many people in the community, many that are probably watching today, have had one or more of these types of skin cancer. So there's one called basal cell carcinoma, which is the most common type of cancer in the world. There is one called squamous cell carcinoma, which is the second most common type of skin cancer. And then there's one called melanoma. And melanoma is a very deadly form of skin cancer. So I'm sure that many people can identify with having heard about some of these skin cancers, but they form a lot of the practice that dermatologists do here in South Florida, treating them, preventing them, etc.
So I've learned in doing so much of these shows that a lot of the cancers that we've seen in other parts of the body are preventable. Can you prevent skin cancer?
Yes. So that's a big yes. So the important thing to know, and as I tell my patients, it's always important to prevent rather than try to treat after the fact. So skin cancer is one of those things that can largely be prevented, not 100%, but for the most part, because probably greater than 90% of most of the skin cancers are related to sun exposure. So it's important to understand all of the ways that you can behave in order to prevent the eventuation of skin cancer. So, number one, what's the three most important things to do to prevent skin cancer? The first thing, avoid the sun. The second thing, avoid the sun. The third thing, avoid the sun.
Yeah.
So the sun is the biggest factor. So how do you prevent sun exposure? We're living in South Florida. We want to enjoy the beach. We want to go out and have fun in the sun. So you shouldn't shut yourself up in the house in order to prevent skin cancer. You don't have to do that, but you have to be responsible about preventing sun damage. So you can do things such as wear protective clothing. There are a lot of companies now that offer a lot of athletic geared clothing that are comfortable to wear, but they are the fabric helps to prevent ultraviolet light exposure. Wearing sunblock is very important. No one in South Florida should leave their house in the morning without putting sunblock on every single day. It's so important. And when you put sunblock on, don't just put a little bit on. Don't just use a spray can and spray some sunblock from a foot away. You really need to be diligent when you apply sunblock. So you want to put a lot on. You want your skin to look white when you're done, but realize that it's going to absorb in a few minutes. And you rub it in. You can even take a towel and blot it. Women can even put makeup on right afterward. But cover the areas that are important. Cover the ears. Cover the nose. Wear sunglasses to cover the eyes. Reapply. If you're going to go to the beach for the day, that's great, but reapply. And what I tell patients, if you're really at the beach, every 20 to 30 minutes, put it on. It doesn't last forever. So these are some of the things that you can do to prevent it.
All right. So obviously sun, very important, and sunblock, very important. So I have a little lesion on my hand, or I see something on my face. What do I do? I'm a viewer and I'm concerned I may have skin cancer. What are some of the things that, are concerning for a layperson to look at if they have skin cancer?
Yeah, so that's important. So if you have something on your skin that is new, it just began to grow, it's bleeding, it's itching, it's burning, it doesn't heal, it's growing. These are warning signs, especially if you've had a history of skin cancer in the past, or if you had a family history, or if you've had a lot of sun exposure, or even if you haven't had sun exposure. Anything that's new and changing like that needs to be brought to the attention of the dermatologist. And that's another form of prevention. Going to the dermatologist in a very sunny environment like South Florida, everyone should be going to the dermatologist at least once a year to have their skin checked. And especially if you have more risk factors like a family history of skin cancer, or you've had a lot of sun, sometimes it's more frequent than that. Sometimes every 6 months, sometimes every 3 months, depending on your particular circumstances.
So, and I also remember that if you're fair skin, you have more risk. Who's at risk? Is there certain people, gender, age, or skin type are more risk for skin cancer?
Yeah, that's exactly right. So anyone with a very fair complexion, with very light colored hair, light colored eyes, a history of significant sun exposure, a family history, somebody with a lot of molds on their body, these are all risk factors for developing skin cancer. If you've had a lot of sunburns when you were a child, and that's a big one, because you don't think, here's an important thing. I tell my patients, think of your skin like a tape recorder. Think of it as a tape recorder, because all of those exposures in your life, starting from when you were an infant all the way till now, all of those exposures, and meaning even when you walk out of your house in the morning to walk to your car, you walk from your car to your work, all of those exposures are remembered by your skin. It's like a tape recorder. It just remembers all of them, and they build up over time. And eventually they begin to accumulate to the point where you start to see the damage. And then that's when you're at greater risk of skin cancer developing as time goes by. So it's a combination of incremental sun exposure and sun damage and time that work together to cause the
Spent all day long out in the sun playing volleyball, getting sunburned, and putting on that gel at night to cool our skin. That our skin remembers that, huh?
Your skin never forgets.
That is bad. Okay. So patient comes to you, you look at it, you make a biopsy, and it's skin cancer. Now Is that really bad? Are they, need chemotherapy? Are they going to die? How bad is skin cancer? Explain that.
So the good news is that most of the skin cancers that we diagnose in the office are very minor skin cancers. So, for example, I mentioned one called basal cell carcinoma, which is the most common kind. So that one is generally treated not very aggressively. Now, that's not to say that there are rare cases when that particular type of skin cancer can, in fact, do damage and become very dangerous. But for the most part, patients tend to develop basal cell carcinomas, and they develop them frequently. Once they have one, it's very high risk that they're going to develop more in life. But they tend to be not very aggressive, and we can treat them using creams sometimes. A lot of times they'll be removed with a minor surgery. Squamous cell carcinoma is a different one. It's a little more aggressive than basal cell carcinoma. So we tend to remove them surgically, but for the most part, as long as we get them early enough, that's all that's needed to cure them. And melanoma is the one that we really need to focus more on. So melanoma is a skin cancer that can be very dangerous. Thankfully, it only accounts for about 4% of skin cancers, but we have to be watchful. And that's another reason to do self-exams. If you see a mole, so melanomas are composed of cells that are the same cells that create moles on our skin. So if you see a mole that begins to change color, change size, begin to grow, bleed, itch, those are warning signs. It doesn't mean that you have cancer at all. You may have all of those signs, and it still doesn't mean that you necessarily have cancer. But those are signs that should increase your attentiveness to get that checked. Bring that to the attention of a dermatologist and get that checked, because melanoma can eventuate in that way. And melanoma is, if it's not caught early, it can in fact progress to something that would need an oncologist, potentially more systemic treatments, and it can be very dangerous.
Yeah, no, I can tell you as a surgeon in treating melanoma, it can be very aggressive. Those patients need what we call wide resections, big areas removed, ridiculous. I mean, you have a little lesion and you have to remove a big area, lymph node dissections, chemotherapy, immunotherapy. So yeah, melanoma could be very, very dangerous. All right. So what we're hearing about skin cancer is that sun is very important. Avoid the sun, protect yourself, put on your sunscreen, and obviously go to the dermatologist yearly to see if there are any suspicious lesions. And if there is, it's not the end of the world. 96%, it sounds like, of skin cancers are going to be okay and you're going to survive. So, we've really kind of educated ourselves a little bit about skin cancer. Now, the next topic I want to talk about is acne. Acne, very, very common. I've seen it in my household. You treated my wife with acne years ago, and we see acne as kids. I saw them in my kids, and then sometimes there's even adult acne as well. So let's talk about acne. What is acne?
Acne, first thing I want to say is acne is really underappreciated as a significant medical condition in our healthcare system today. So a typical scenario is an acne patient is bothered by their acne. They go to the doctor. The office is very busy treating skin cancers and doing cosmetics and doing a lot of things. So it's very rare that a doctor will sit down with that patient for more than 5 minutes and ask, how does it bother you? How can I help you? What types of treatments do you think you'll be comfortable with? It's very rare that happens. So acne is something that really needs the attention, because it can affect acne sufferers, and that's how I refer to them, because they're truly suffering very significantly. Their quality of life can be impacted very significantly. So having said that, acne is a condition that involves the pores of the skin. So if you look in the mirror and you see the little openings in your skin, those are the pores. If you look deep inside those pores in the microscope, you'll see a structure technically called a pilosebaceous unit. So what does that mean? It means it's a combination of a hair follicle and oil glands. And that's the structure where acne forms. And that's the structure that comprises the pores. Now, why doesn't it happen in everybody then? We don't know the complete answer, but we know that one of the factors is the way that the hormones fluctuate during our lifetime. So almost everybody is at risk of acne. Almost everyone has some degree of acne in their lifetime at some point. But we typically see acne in teenagers, in young adults, especially women in their 20s and 30s, even patients who are undergoing menopause with the hormone fluctuation. So those are things, the hormones are responsible for triggering the oil glands in that pore that I described to produce more oil, more than the gland can hold, and to become inflamed and clogged and producing an acne breakout.
So when you have all these bumps and, the acne, remember, in high school, you used to give them real bad derogatory terms. What are we seeing in these bumps? What are those bumps that are on those patients' face?
So it's full of inflammation. Acne, if you look in the microscope at acne, you'll see tons of inflammation. It's a very inflammatory condition. And that inflammation does a lot of damage. It can lead to acne scarring, which can be permanent. And as you mentioned, the derogatory terms, see, that's part of the process. A lot of kids, a lot of my patients say they have contemplated not going back to school because of that type of thing. So it's a significant impact.
And then what about the parts of the body? So much on the face. I've seen acne, I think, on the back, but maybe some areas are spared. Why? Why isn't it localized in only a couple places?
Well, it has to do with where the sebaceous glands are. So the sebaceous glands are those oil glands that I mentioned that are attached to the hair follicle in the pore. So there are lots of sebaceous glands on the face. There are lots of sebaceous glands on the chest and the back. So those are common areas where acne develops.
Okay. And then who's at risk? I mean, you mentioned the young people. So young and hormonal. Is there a patient population or a underlying condition that's going to make somebody more at risk? Males versus females and so forth?
Yeah, there are a variety of things that predispose to acne. For example, a woman with polycystic ovary syndrome, she can have hormone changes that can put her at significant risk of having very resistant acne. Bodybuilders who are taking anabolic steroids are at risk of having significant acne. People under stress, college students taking final exams, that stress can lead to different hormonal changes that can cause acne. And also skincare products. If you use one that isn't safe for acne, you can end up with different types of acne, pomade acne, comedonal acne that can be difficult to manage. So there are a lot of reasons that people can develop acne.
All right. And then what are the real misconceptions out there about acne? I mean, I remember when I had acne as a kid, we had some wipes. We had maybe a little cream that we used to put on our face. You buy it over the counter. What is that? Is that still the case?
So a couple things. So as far as the wipes and the creams over the counter, they have their role. They're helpful to some extent. But for the most part, people who are really coming for acne treatment, their acne is a little beyond that. So that's not going to be sufficient. However, misconceptions, the idea that acne is a surface problem because you can see it. So if you can see it, must be just on the skin. Let's just clean it off. That doesn't work. As I told you, it's in the pore. It's deep below. It has to do with how the hormones are interacting with all of these structures. So scrubbing the skin just makes it worse because you're now inflaming the skin even more. Eating chocolate, eating fried foods. A lot of patients think that's important, but that's actually, there's no scientific basis for that. So we don't really have a definitive regarding diet and acne as a misconception. We think that maybe having a high sugary diet or eating a lot of dairy in your diet can exacerbate acne because it's an inflammatory diet. It makes inflammation worse, so it can make other inflammatory conditions worse, but not necessarily the cause of acne.
All right. So I'm listening to the show. I'm listening to Dr. Colsky. I have some acne. What do I do? Do I go to my local pharmacy, pick something off the shelf? Do I scan the internet? Do I go see a dermatologist? What do I do if I have acne?
So one of the biggest impediments to somebody asking that very question is what I call noise. So what's noise? Noise is all of those things that you're encountering. You're on the internet, you're seeing all these ads coming up. This is going to cure your acne. That's going to cure your acne. You're watching cable TV and all these commercials, before and after pictures showing horrible acne and then a clear face using this product. So that's all noise and you're confused. You don't know what to do. The best thing to do is to go and see a specialist. You want to break through the noise because that noise is going to delay you. That noise is going to continue your frustrations with acne. And remember, the longer the time is that you're having breakouts, the more risk you have of scars and more emotional consequences of having acne. So don't procrastinate, take action and get your acne dealt with from a professional.
All right. So I have acne. I go see the dermatologist. And so what you're saying to me and what you already told me is that you're not going to give me something to scrub on the skin, because acne is deeper than that and really, more serious than that. So what is the treatment for acne?
So when we have patients in the office, we discuss the cause of acne. We go through that with them. I have a whiteboard that we use. We talk about it. And we explain all the different points where the different medicines can work. And we talk about the different medications. What we do also explain is that a lot of the things that they've been using, maybe even they've been given some topical medicines by other doctors, because that's a typical scenario. You go to the doctor, you get topical creams, and they're supposed to work, but oftentimes they don't, because they're just not effective enough. So oftentimes we talk about systemic treatments, pills. There are various pills that we can use. In women, we have a couple of different ones. One that helps with the hormones that can be a significant factor in acne formation. And then we have Accutane, which is a common, a lot of people have heard of Accutane. There are a lot of misconceptions about Accutane too. So before you rule out taking Accutane, you should have a conversation with your dermatologist. And those are very effective.
And the treatment, I mean, Accutane is a different type of medication. It's not an antibiotic. It works in a different way. But is there antibiotics as well for acne?
There are antibiotics, and sometimes they have use depending on the type of breakout. I call it, for example, situational acne, where you're taking an exam, you're under stress, you have a life event, you're under a lot of stress. Sometimes antibiotics are very helpful there. If you have chronic acne for a long time, a lot of times antibiotics are not that helpful. So sometimes they're worth a try. Sometimes we even combine them with other things like light treatments that sometimes can synergize. And we do that often. And if it works, great. If it doesn't, then we move on to the more effective options.
Okay, so there's a lot of options. And one of the other things you mentioned, which I want to go back to, is you said about chocolate. But if a patient says every time I eat chocolate I break out, they shouldn't be eating chocolate then, right? Or I know there's no direct scientific association, and we've never been able to prove it, but if you notice that something, a food, a medication, or an activity gives you acne, you should probably avoid it.
Absolutely.
Okay.
So that's exactly what we tell our patients. We tell them exactly that. There's not necessarily a definitive scientific answer to that, but if you have any food that every time you consume that food, you start to break out, then that's particular to you, and avoid that food. You're absolutely right.
All right. So you're a high school kid and you have an acne right here in the middle of your forehead, and the world is done. You're done. You're never going to even see college. Of course, acne is curable, and you can help these individuals, right? Is it curable?
Well, sometimes we don't use the word cure,
okay,
but we almost can use that, because there are medicines. For example, some of the medicines I discussed, Accutane is one that is the closest thing to a cure that we can imagine. And almost everyone who takes Accutane does very well. And 2/3 of those patients who take it the first time typically don't get acne again. So you can consider that type of a cure. So yes, there are very effective treatments. There's no reason not to consider treatment if acne is causing significant emotional consequences for you. We have enough medicines where we can fashion a regimen for you that should be able to be very helpful.
Wow, that's great. So what I've understood is that if you have acne and you see a pimple, is that an appropriate term? Can you say it?
I use that term.
Okay.
As well.
If you see a pimple in the mirror, turn off the noise, go see your dermatologist, and let a professional help you. And, don't waste time with a bunch of creams. Now, the last thing I want to talk to you about is something that's pertinent to skin cancer, pertinent to acne, and I hear it. I get asked about it all the time in my practice, because I traumatize patients with surgery, and they always want to know about scarring. So, if I had a skin cancer removed, if I'm suffering from acne and is being treated, or if Dr. Gonzalez just did surgery on me, how can I decrease scarring? How can I make my scarring less? Are there certain tips you can give our viewers with regard to scarring?
Yeah, I think that's an important question. So surgical scars, for example, they tend to be hypertrophic, which means they're thicker. A lot of times they're thicker. And with thick scars, those can be more easily addressed, because we can inject them with some cortisone. And cortisone tends to flatten those thick scars down. So you can get thick scars from surgical scars. You can even get them from acne scars or any scars, depending on your particular genetic tendency on how you heal. So that's one way to treat scars. Other scars can be more difficult. Acne scars can be very difficult. we do have some techniques that can be very helpful. Local techniques where we treat the scars with very minor surgical procedures that can be very helpful and very easy. But overall, they're difficult to treat. As far as preventing scars, using some of these options that you'll buy at the drugstore, they're not extremely effective. So moisturizing your skin always helps the skin heal better. Preventing sun exposure after a surgery can help it to cosmetically appear better. So it's a challenge, but depending on the particular type of scar, your dermatologist or your plastic surgeon may be able to help you.
Yeah, that's the point, because every time the patients always ask me, is it safe to put on product X on my scar? I want to use this. I want to prevent scarring and, and decrease the amount of scarring. But I always tell them it also has to do with your genetic and the way you scar, right? Because I've learned that, the best way to predict the way your scar is going to look is the way other scars on your body look. If you scar very nicely, then you're likely to scar very nicely as well.
That's right. It's very genetically determined, and also the part of your body. So the chest tends to scar more than other parts. The face tends to scar less. So, but it's very genetically dependent, as you mentioned.
Well, that's good. The face scars less. God is good. God made that right so that when we for the appearance purposes.
Exactly.
All right. Well, listen, we learned a lot today on Miami Community Health. We've learned about skin cancer. We've learned to avoid the sun. Put on your sunscreen. I can't believe Dr. Colsky told me to put on my sunscreen before I go to the hospital. I mean, I show up there and look like I'm going to the beach, but put on your sunscreen, avoid the sun, go see your dermatologist if you got acne, and of course, scarring, moisturizing your skin. So I want to thank Dr. Arthur Colsky, our dermatologist, for coming with us today.
Thank you, Tony. It was a pleasure.
All righty. And I want to thank you once again for being with us in Miami Community Health. Dr. Anthony Gonzalez signing off again. Thank you.